Right, welcome back. We want to dive into that conversation that we also promised you earlier. Allow me to introduce my panel this morning. Jesse on my far left, he is the director for Choice Care Pharmacy, and sitting closer to me, I have Patrick Adera, the chair, Kenya Pharmaceutical Association. Gentlemen, it's good to have you this morning to help us also understand a lot of, should I say, the intrigues of the pharmaceutical industry. Let me begin with Jesse on my far end. Let's talk about generic drugs and helping Kenyans understand that concept around it. First of all, perhaps from a layman's language, what are generic drugs and what is their core mandate? Why are they there?
Thank you. Generic drugs are basically, when a drug first comes into the market, it comes with an originator brand, which we erroneously refer to as original. But basically, they should be called originator. So the originator brands go through a circle, and then once the patency is done, then anyone else with capacity and with skills to make the same molecule in a different with a different name comes up with what we call generics. Now generics therefore basically come up as the same molecule. In most cases, you find generics come around with better prices. They are fairly priced, they're cheaper, because then the cost of innovation has been taken care of by the innovator. Basically, I think what has erroneously been alluded to in the market is that the generic drugs are not good. Is basically an error that we've got to live with, and we have lived with it for a long time. They are perfect, they are good products, only that they are an offshoot of the originator. They're not the originator. So if I'm able to manufacture a molecule that was originated by someone else years back, I can do that, and my product would still be good, as long as it has gone through the full circle of regulation. Right.
Help us understand some of the effects of counterfeit drugs and what that means, and what that does, rather, to one's body.
The effects of counterfeit, I mean, looking at a counterfeit, I think, by definition, is that which imitates the real. So if someone came up today and put on exact clothes like you're putting, a face like yours, then that would be your counterfeit. It won't be yourself. And the same thing, counterfeit products are imitations of the authentic molecule. I don't want to say original. Authentic molecule, or the authentic drug that has therapeutic effects that are intended to be used against a particular ailment. Now, the effect that we have is if you use a counterfeit, then it means, one, you're not sure what you're using. There are possibilities that it does not have the label claims that ought to be with it. Right. For example, you use an anti-malarial, and it is not what it claims to be, then it won't cure you for malaria. You use a product that has a claim as an antibacterial, when actually the content therein does not measure up, then that's a counterfeit. It might be imitating a known brand, a known product, but it really won't help you. So the effect is that you end up not recovering, and if you don't recover, you know the end game.
The end result.
The end result.
All right, Adera, as the chair Kenya for Pharmaceutical Associations, the other sad part, or the other, there's a fear of abusing of these drugs. Especially, I'm glad we also touched on the counterfeit. But first of all, before we come to the abuse of drugs, perhaps what is the association doing to make sure that our counters do not have counterfeit drugs?
Yeah, one is that all the genuine outlets that are engaged in pharmacy service delivery are expected to be regulated. That is licensed by the Pharmacy and Poisons Board. And what that means is that in every outlet there will be a qualified person to be in charge of the service delivery process. Just to make sure that the products on those counters are safe, is that the entire supply chain of drugs is regulated from the importer when the drugs arrive at the country, the checks that are done at the port of entry, then to the wholesalers, to the distributors, to the retailers. Then again, it is also the responsibility of the regulator to do what we call post-market surveillance, because it is possible for the right products to be on the shelves, but the wrong or the poor quality products to get their way still into the country through our porous borders. So as an association, what we are doing is that we are working very closely with the regulator and educating the public, and also making sure that all outlets in Kenya are licensed and regulated. Unfortunately, that is not the case. You had so many cases of quacks and so many illegal pharmacy outlets. So we cannot assure Kenyans that 100% our products are safe, because with the presence of illegal outlets, still there is that danger, the responsibility that these products are there. But from where we stand as an association, we've ensured that all facilities that are owned by professionals are licensed and have qualified persons, and the products are genuine.
Right. What would you, though, like to see the government doing and playing its role? Because those counterfeit drugs are imported through our borders.
Yeah. I think one is that the government should build the capacity of the regulator. Currently, the Pharmacy and Poisons Board has about 60 pharmaceutical inspectors. 60 pharmaceutical inspectors cannot do anything in a population of 45 million Kenyans. And therefore, they cannot be in every village, in every county, making sure that things are done right. And therefore, one is the government to build the capacity of the regulator and come up with stiffer penalties. And I'm happy that the current reviews that are being done on the health laws has increased the penalty for operating illegal pharmacies, for having in possession counterfeits and substandard products. And the other thing is that the government should also increase surveillance along our porous borders, Busia border, Keancha, our ports of entries, just to make sure that Kenyans are safe. And the biggest thing is that we need to have more forums of creating awareness, because to most of the Kenyans, a medicine is a medicine, a pharmacy is a pharmacy. They don't know whether this is licensed and this is not licensed. To them, anything opened and it's written Duka la Dawa is Duka la Dawa to them.
It has a stamp.
Yeah,
okay.
And anybody on a dust coat to them is a doctor. So we need to create more sessions where we'll discuss this and make sure that the public is well informed.
So Jesse, how does a Kenyan know? How does a Kenyan know that this drug is the right drug?
I think Kenyans are largely at a loss. And I basically would like to quantify that when a Kenyan goes into a pharmacy, it is every Kenyan's right to ask to be seen by a professional. So that's their right. And I think that's a right that they have let go. We just walk in and we are served by anyone. So a Kenyan, first and foremost, should insist that they're served by a pharmacy professional. And in the current dispensation, the regulator has issued licenses. So you should, when you go into a pharmacy, you should be able to see the picture of the person serving you.
All right.
If that is not, if the person serving you is not the picture you're seeing, then you should think twice. But that notwithstanding, the bigger facilities that employ more than 1, 2, 3 professionals may not have everyone wearing, having their photographs out there. But somehow they should be identified. I think for every Kenyan, currently the Pharmacy and Poisons Board, they've come up with a way to authenticate to pharmacies that are licensed. So there are codes out there that I think the members of the public can basically use to know whether you are being served at the right place. And in any case, the name that has come back to you in your phone is not the name that is serving you, then you have all the reasons to query whether you are getting good services. My
worry perhaps is just not even the likes of malls, but for our low-income communities. Like Adera has said, you see Duka la Dawa, which a lot of them is there in low-income places, the likes of Kibera, Kawangware, etc. Duka la Dawa. how are those individuals meant to know that if I go get a prescription for my headache, you know, as simple as that is, that this prescription is right?
When you get into pharmacy, and as you rightfully mentioned, in the areas where low-income members of our communities live, they are served in most cases majorly by unqualified personnel. And that is the sorry state of what we have in our Kenyan affairs. Because I practice in one such places where I'm surrounded by everyone who is not regulated. And all they do is, I think this is a good indicator. When you see chemists or pharmacies in your neighborhood closing down when the regulator is around, then that is an indicator that everyone who had closed down is not authentic. I think to me that is the highlight, because whenever the Pharmacy and Poisons Board inspectorate team are coming around, you find 3/4 of the pharmacies in the neighborhood closed down. Why do they close down? There's something wrong. And if there's something wrong in those pharmacies, why do you continue to go for service from them? So I think that's basically a good indicator. It's a classic indicator. But as I said again earlier on, that currently the Pharmacy and Poison Board have given a banner to every pharmacy that is licensed. So having that banner, looking out for that banner with the Pharmacy and Poison Board mark is also an important indicator.
All right, Adela, let's talk about the abuse of pharmaceuticals rather. When does perhaps that pill I take for my headache become now an abuse? When draw for us that that line?
Yeah, drug abuse basically is overuse. That is one, and two, unnecessary use. One thing that we know from our medical school is that headache is a symptom of an underlying problem, and therefore painkillers are supposed to be used as just for symptomatic management, as you wait to have a thorough investigation done and a proper treatment given. Unfortunately, back to what you've just said, is that most of the Kenyans get their services from those very, very rural and low-income areas, where people will walk into a pharmacy, you have a headache, you don't want to know what is causing the headache, all you want to is give me some few Brufen tablets, give me paracetamol, give me aspirin. The problem is that some of these painkillers have very serious side effects if used for a prolonged time. And a good example are the NSAIDs. You use aspirin for a very long period of time, you start complaining of stomach ulcers. And most of the people that you hear talk of stomach ulcers, if you look at their history, you realize that they had some serious pains before, and they used these analgesics for a long period of time. The other thing is that you also have some painkillers that contain codeine, like betapine. So these are tablets that when you use them, you feel high. And continued use of these tablets make you become addictive. Every time you feel a slight headache, you can't use any other medicine other than the one that you're used to. So there are so many effects related to over-the-counter products that are abused, ranging from very mild diarrhea, vomiting, to serious kidney problems, liver problems, stomach ulcers. And therefore, to me, I'll still encourage Kenyans that if it's possible, have your problem well understood and clear diagnosis done before you are put on medicines. Yeah.
Jesse, I'd love to hear your thoughts on that, the aspect of when now patients abuse the drugs.
Right. I think when patients abuse the drugs, it means then they used it once and it was successful. I mean, they were treated, they felt better. And so in their mind, there is this feeling that this is the only medicine out there for me. Whenever I feel a slight stomach ache and I think I'm having food poisoning, and because my doctor gave me an antibiotic called X, I simply go out and say I want medicine called X. Now they are beginning to abuse that product. Why? Because it is not usually the case that all the symptoms will lead up to the same diagnosis. So now that's an abuse, and basically they get dependent. I think the effect of such abuse sometimes, like when you talk, you get to the antibiotics part of it, is that you become also resistant to that product because you're using it when actually it's not necessary, and you overuse it. Many times they come and they tell you, Doctor, just give me 2 tablets. Okay, and you know, for an antibiotic, you need to have a 5-day at least course, but they say, I want 2. Now, if that person standing before them is not a professional, they will give the 2 tablets, they will give the 2 pills, which will actually deal with the symptoms, but will not help the person. So the resistance also comes up. But back to pain relievers, I think pain is a major problem in our communities. Why? Because of where we live. You wake up in the morning, we have, factory laborers. After, jua kali artisans, after a long day's work, they feel some pain. But does it call for relief by using medicine? Maybe not. They just need to go and relax at home, and they'll be okay. But you see, it has been basically encrypted in their mind that every evening after a hard day's job, I need to get a pain reliever, and then it will relax me. So that becomes then a case of an abuse of that product. And as Patrick said, there are some products that will also lead to dependence. Talking of products that contain codeine, for example, the tramadol range of products, they mimic morphine, for example. So basically, the more you use them, the more addictive they become. And what they don't know is sometimes what we look at as pain in the evening after work is just because I'm exhausted. I've been working. So if you've been working, then you're bound to be exhausted. You simply go home, take a shower, and relax. You don't need medicine for that. Do a cup of tea, and you're good. And
call it a day.
Yeah, and so what happens is where professionals are, then we're able to advise them, tell them, look, I've seen you come for this medicine every day. What is the problem? What's the underlying problem? Then you'll be able to discuss with them objectively and tell them, look, I don't think this is the best way to go around about it. Can you today just go home, take a shower, take your tea, and then relax, and then tell me tomorrow how you felt.
All right.
Yeah.
Let's take a quick commercial break. When we come back, we'll open our phone lines for this specific conversation. So if you're watching at home, you can be part of the conversation here in studio. Let's take a break there. We'll be right back.